Welcome to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry, of course, straight from the experts. I'm Ian, and every week I'm chatting to Dr. Clifford Yudelman from OptiSmile, and we take a deep dive into the world of dental care from a consumer's perspective. If you're looking to brighten your smile or simply protect your wallet, we have got you covered with practical advice and the latest insights. So stick around and stay tuned as we uncover the secrets to maintaining both your dental health but also your finances. Dr. Clifford Yudelman, a big welcome back to you.
Thanks, Ian. Thanks for having me back, and hope you had a great week, and it's great to chat to you again, and looking forward to rounding up episode 3 on stress-free dental visits today. We spoke about oral sedation and conscious sedation last time, and before that was why are people afraid of the dentist. So today's just a general one on how to prepare for a stress-free dental visit. So I'm ready when you are.
So, Dr. Yudelman, why is proper preparation so important before coming in for a dental appointment, especially for the anxious patients?
So, if you're prepared, it helps you walk in feeling more in control, knowing ahead of time what the dentist is going to do at that visit. So, for instance, if you're going in for a checkup and x-rays, to know that the dentist is not going to all of a sudden want to do a filling on you at the first visit that you're not prepared for. At OptiSmile, we never do any treatment on the first visit unless it's an actual emergency and we know ahead of time that's what the patient's coming in for. But in general, we always do an exam and x-rays and no actual procedures in that first visit. So, and for the people that are really nervous, we even can do a video consultation ahead of time, which we do, and prepare them. So yeah, being prepared. Also, if you already have had your exam and you're coming back for actual treatment, then knowing what the dentist is going to do, how they're going to do it, asking questions ahead of time, so that mentally you can be relaxed and you've got a plan in place. If you're having sedation, then you'll fast ahead of time or whatever it is that they told you to do.
Okay, and in terms of food and drink, what's best to consume or even avoid before a procedure involving sedation or local anesthesia?
I always recommend that, sedation aside, so we'll talk about sedation in a second, I always think if you at the dentist, then like our practice, some of the treatment rooms, we keep it really cool. We've got blankets for the patients, but you always want to be in comfortable, loose clothing and bring a hoodie or a jacket or something comfortable in case it is a bit cold for you and they don't have a blanket in some cases, because if you're a little bit nervous and then you're cold as well, you start shivering and shaking. You're not sure if it's from the cold or from nerves. And also, if you're there for a few hours, then you might not be able to eat afterwards because of numbness. When you have an empty stomach and you got maybe low falling blood sugar because of stress, that's also a horrible feeling. So I always tell people, have a good meal, not right before. You don't want to have a really full stomach. If you're having local anesthetic, you won't be able to eat for a little while afterwards, especially if it's on the lower. On the upper, it does wear off within an hour or so. On the lower, you can be numb for a good 2 or 3 hours. And I did mention I'll get back to sedation. So the dentist in your particular case will advise, generally there's some fasting, but it's not like for a general anesthetic. So it's not as strict a fast, but I definitely would have a fairly empty stomach if you're having sedation. Although nausea and vomiting with sedation is very rare. It's not like a general anesthetic. And avoid alcohol and caffeine. Don't have 3 double espressos and come to the dentist if you're a nervous patient.
Oh, no.
Rather, and that'll increase your heart rate and anxiety. And of course, if you're taking a Xanol ahead of time, which we discussed, you don't want to have it, wash it down with an espresso, because it will counteract the sedative.
Yeah, no, that's not clever. But yes, absolutely, it's terrible when your blood sugar is just crashing from all that stress, and you get all sweaty and dizzy and all that stuff. It's not going to help you. So it's definitely important to eat something beforehand, not obviously immediately beforehand, but like you said, in the hours before. But Doctor,
yes, and on that note, I recommend something with some protein and some fat, maybe a piece of cheese or a toasted cheese. Definitely not a high carbohydrate, high sugar. You don't have a lunch bar and a Coca-Cola or just a some very. You don't have a muffin or something. Yeah. It needs to be something with some fat and some protein. Making me hungry now. I'm thinking of a nice chicken breast with some rice, maybe a bit of Japanese mayo on there or something like that.
Yeah, so you don't come crashing down like a roller coaster with your blood sugar. But Doctor, let's talk about mental readiness. How can someone calm their nerves on the drive or right before they step into the clinic?
Yeah, so simple breathing exercises can be done anywhere. There's something called box breathing, where you inhale for 4 counts, hold for 4 counts, and exhale for 4 counts, and then you hold for 4 counts. Or you could do a nice deep inhale through your nose for 5 seconds and out through your nose for 5 seconds. About 6 breaths a minute. I did recently listen to a book called Oxygen Advantage, and I even had some coaching with a breathing coach, and it's amazing how much you can achieve just with simple breathing. Listening to calming music or a funny podcast, that also distracts the mind in a positive way.
Okay, and then any relaxation techniques like breathing exercises that you recommend people try in the waiting room?
The box breathing that I mentioned, and also you can do a quick body scan from head to toe, relaxing each muscle group. Guided meditations on apps can also help, and many offer like a short 5-minute calming session. Just if you're sitting in the waiting room, just start off, relaxing your hands, relaxing your arms, relaxing your shoulders, relaxing your neck, and just go through each part of your body and relax while breathing very deeply through your nose. And before you know it, they'll come and fetch you, and you'll be in the dental chair. We try not to keep people waiting, because we know even if you're not nervous and you get kept waiting, you get a bit aggro and your adrenaline builds up, and then that can mix, with fear and aggression, and then it just starts off on a bad note. So on our dental practice software, if someone's been in the waiting room more than 5 minutes, it starts flashing. Everyone can see, that patient's been kept waiting for more than 5 minutes. So,
that's awesome. Because yes, for me also, sitting there and listening to all the noises and whatever you can hear, it just that anticipation, the nerves are just terrible. And then you have second thoughts and you start looking at the door and you're like, maybe I should run away. You know what I mean?
You've been there.
Yeah.
We keep the waiting room. We're very lucky. Our place is 500 square meters, and the waiting room is like all the way around a corner down a long hallway, and then we've got these everything's like this plate glass, which is very good for soundproofing, 12 mil glass, and we keep the doors closed. Also, we don't have those very high pitched dental drills anymore. We have these electric motors with ceramic bearings, and they really don't make much noise. It's always, if there's kids in the chair, sometimes it's like a sibling that's come along, and the 3-year-old's actually crying because it's hungry, and then you're sitting in the waiting room and you think that someone's doing something to the kid. In the meantime, they're just waiting for their brother or sister. Crying kids, that always puts me off. But
yes.
Luckily we don't have that. Yeah.
But I love that you have that thingy flashing to show you that somebody's waiting, because if you sit there and you think too much, it's not good for you. So I think that really helps the process. Well done. That's a very
Yes.
good idea, actually. But
Yeah.
doctors, sometimes having a friend or a relative along can also help. Do you encourage patients to bring a support person?
Yeah, definitely. So, especially if there's sedation, you do need someone to come with you and to drive you home. We often invite. Sometimes you'll have a teenager or a younger female, and they like to bring a friend or a school friend, and we've got a special bench in the room for a anxious parent to sit and be there, or for a friend or someone to come hold your hand. And we do encourage it if somebody does want to bring someone with. Yeah, definitely, for moral support and practical reasons like driving you home.
And what does communication with the dental team look like beforehand? Should your patients share their fears or concerns with you in detail?
Absolutely. The more we know, the better we can accommodate. If you tell us that you hate needles, for example, everybody hates needles. So we use topical gel. We use a machine called a wand to give local anesthetic, which gives it very slowly. We can give you sedation or offer you intravenous sedation on our form. And we always get a full new patient form online before we see a patient. We've got a question that says, how scared are you? If 1 is not at all and 7 is very scared. So we get to see, and the reason why I did that, so it's not out of 10, because then you can just pick 5 for everything. You got to pick, you're either not scared or you're scared. It's either a 3 or a 4 or a 7. People put a 7, they often will book a video consult ahead of time, and then we can discuss sedation. I've even had patients that have required sedation even for their exam. And so we'll organize that ahead of time, and they can take a sedative just even for their checkup. Obviously, they bring their husband or their wife or the partner.
And how about music or podcasts during the treatment? Do you find that helps patients reduce stress as well?
Yes and no. So definitely, if patients are having longer procedures, we've got several pairs of headphones in the practice. The latest one is one of these ones that I think it's called Shocks with a Z. It fits in front of your ear, so you can still hear us talking, as opposed to patients putting in their own earpods with noise cancelling. Because a lot of the time, if someone's very, very scared, then you can't actually tell them that I'm going to do this and I'm going to do that, or move your head. If they put in earpods and they put them on full blast, and they just lie there shivering and shaking, there's not much you can do to calm them. But yeah, definitely, if someone's come once or twice and they've taken a Zanor, they bring their own headphones, and as long as they maybe just use one or they use ours, it definitely helps to listen to podcasts or music. We've got individual speakers in each room connected to YouTube Music, and we ask the patients, what do you feel like? And very often it seems like people like U2. Maybe it's because I like U2, but
okay.
We listen to a lot of U2 or 80s, or
nice.
We get a lot of older patients, and we put on things like Andre Rieu, however you pronounce his name, like some waltz music, depending on, and that really helps people to relax. And also just knowing that you care about what they want to listen to, that helps as well.
Very, very nice, doctor. But if sedation is part of the plan, what should a patient expect in terms of transport, and why is that so crucial?
Yeah, so if you're having intravenous sedation, you definitely need a driver, because sedation can leave you groggy and impair your reaction times. Driving isn't safe afterwards, so you have to bring someone with. If you're having oral sedation, we don't recommend driving, although some patients, against our wishes, drive. They don't feel very sedated. Some of them will wait around in the shopping center for a while. If they're walking, we make sure that they, steady on their feet. Some people will catch an Uber. Oral sedation, if you're taking something strong like Dormicum or Valium, if you're taking Zanor, you're still very, much awake and conscious. So it depends on the type of sedation and what the dentist is giving you. So I think you do need to check with your own dentist on that one.
And for longer or more complex procedures, do you recommend taking a day off work or school maybe to recover?
Yeah, I mean, why not? You deserve it. You've been to the dentist, eh?
Yeah.
Even if you feel physically fine and you've taken Zanol, you're not going to be very much in the mood to work afterwards. Although we do have people who work for themselves and they go home and they maybe tidy up their desk, or they just look through the emails, but you don't want to go and do important legal work or sign documents or do anything if you've had sedation. And just take it easy. As I said, you've been to the dentist, have a day off.
Yeah, but don't buy a house or something,
Yeah. Don't sell your house either.
Yeah, exactly. And Doctor, finally, for anyone feeling overwhelmed, what is the single best piece of advice that you can offer for a smooth, stress-free dental visit?
Communication is key. Communicate openly with your dentist. Don't try and cover up the fact that you are scared. If it's your first time phoning the dental practice or sending a WhatsApp, tell the receptionist. See if the receptionist cares. The receptionist often sets the tone for the practice. If you call a practice and you tell the receptionist, I'm really scared, what does the dentist do to help with this? And the receptionist sounds like she doesn't care either way. That might not be the place for you.
Yeah.
The same, you could check, does the dentist do free video consultations, or can you ask the dentist to call me at the end of the day because I have some questions? You got to know whether they care about you, because knowing that someone cares for you or cares about you as a person, and that you're not just a number, that really, the communication, that's what helps about communicating. The more we know, the more we can tailor your experience. And most fears are based on the unknown. Once you see that we're here to support you, the anxiety often decreases significantly. And as I mentioned before, we get patients who come in and for 2 visits, maybe 3 visits, they need Zanol. And then after that, they say, that stuff doesn't even work. I don't need it. I'm not scared. Let's just go ahead. And that's what I love about prescribing Zanol over much stronger sedation. If you get knocked out every time, or you take a Dormicum and you can't remember, then you're going to need it every time. But if you very lightly sedated, just to take the edge off and to maybe allay any past bad experiences, and then that's if the dentist is gentle and you have a good experience and there's no pain and the injection doesn't hurt, that goes a long way. And those are often the patients that give us reviews afterwards, the ones that were most nervous. I think we're up to almost 390 Google reviews now. And
wow.
People, and people have written the most amazing things. And as I said, so often it's from people that were nervous before they came in, and maybe after several months of treatment, or maybe after 6 months of Invisalign and some whitening and some bonding, they're our biggest fans. And it's amazing.
Yeah, it's always worse in our heads, when you walk out, you're like, hey, that wasn't so bad, That's usually the case. We always imagine the worst. Yeah. That's the thing we do.
Yeah, it's like years ago, before I developed a fear of heights, I went tandem skydiving in Australia. And, when you're free falling, you do poop yourself, and it's always worse. But once the parachute opens, you get to enjoy the view, and it's like a gentle sail down.
And
you see the and I landed on a soft beach as well. So.
But Doctor, thank you. That was a very reassuring podcast today, and I certainly won't be scared if I ever come to you.
Thanks.
I think it's all to do with communication. Don't hide your fear. Talk to your doctor, your dentist. Tell them how you feel and let them accommodate you. And like you said, if they don't really care about it, you're not in the right place.
100%.
Yeah, they should care about it.
Yeah.
And that's it for another Save Your Money, Save Your Teeth podcast. Dr. Clifford Yudelman from OptiSmile, thank you so much once again for sharing your expertise with us. We appreciate it very
Thank
much.
you. Thank you. And looking forward to next week, where we'll be talking about a new subject, digital dentistry. So be sure to tune in and subscribe.
Yeah, new chapter next week. Looking forward to it. Dr. Yudelman,
Yes.
thank you so much. That was Dr. Clifford Yudelman from OptiSmile, and also to our listeners, thanks for joining us. Remember, while we strive to provide valuable insights with the podcasts, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe to the podcast also for more enlightening discussions, and join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.